deadlines which I would consider unreasonable, quite frankly, because we've had to advertise the fact that we're having public hearings on the bill before the bill was even referred. But if we waited for the bill to be referred, because it was also only, we would not have been able to put out public hearings, for example, on the Division of Revenue amendment next week, and requires the final mandate from us on Tuesday. In order to get the final mandate to them on Tuesday, on Monday, we are sitting on our final mandate from the Western Cape. And we're also dealing with other matters at the same time. In order to have a final mandate on Monday, we need to have a negotiating mandate. Since they need the negotiating mandate tomorrow, we essentially are having the meeting today, which is the presentation, the public hearing, and the negotiating mandate. And you will remember last time I actually advocated for the negotiating mandate not to be at the same day as the briefing and the public hearing for this exact reason, but with the tight deadlines that the NCOP has given us, unfortunately, there has been no other option. And if you wish, and I do think it would be worthwhile, we can look at how we can possibly include that in such a report. And that's also why I'm going to give members time after the public hearing, a short suspension, and before we come back and do our inputs for the report, just so that we can get our thoughts together and everything, because it really is a very, very unreasonable timeline at the moment.
Okay, thanks, Chairperson.
No problem, Honourable Mvimbi. Mr. Kenyon, I'm going to leave it up to you to introduce your team to us.
Thank you very much, Chairperson. And it's a pleasure to be with you today, even in electronic format, and we're really deeply appreciative of the committee's time in processing this bill so quickly through the whole parliamentary process. I think it's very appropriate given the urgency of the need for the funding that's contained in the bill. I have an esteemed team with me today. We are trying to make the best use of the current circumstances. So normally it's very expensive to fly down to Cape Town to present, but one of the savings one has, we don't have those travel costs. So we're taking the opportunity to let one of my colleagues, Betu Ngube, who's my deputy, who's worked on the Division of Revenue Bill for years, but hasn't actually presented to you guys before. So she's going to take you through the first few slides of the presentation on the overview, and then my colleague Marumo Make will take you through the provincial changes, and he is the budget analyst for the Western Cape, so you're in good hands there. And then Pretty Lunga, national grant changes, and she is also a very experienced Treasury official dealing in our grants management unit. So you're in very capable hands here. I'd ask my colleagues to quite quickly, mindful of the time pressures that are on the committee. Sorry, I'm just having a bit of technical difficulty with slide sharing, but I'm going to ask Zetu to take it from here. Zetu.
Thanks, Steve. With your permission, Chair, I'd like to not show my video. I have bandwidth issues. When I do, I get disconnected. Can I continue without?
No problem. I just also got kicked off and had to come back in, so don't worry about that. Yeah.
All right. No, thank you. Thanks. So this slide outlines the Division of Revenue response since COVID was declared a national disaster. So the initial response from the Division of Revenue happened shortly after this declaration, which saw funds released from the provincial and municipal disaster relief grants. This was an amount of just under 467 to assist the provincial departments of education with the initial response. This was followed by the release of 151 million to municipalities from the municipal. This declaration also enabled the repurposing of an amount of 7.4 billion in uncommitted local government grant funds to respond to the pandemic. This was done in terms of Section 20, subsection 6, that in responding to the disaster, items funded for within the parameters or purpose of the grant. So this was all before the beginning of the 2020 financial year for municipalities. In terms of the 2020 Division of Revenue Bill, which was enacted on the 23rd of June, the grant frameworks that had to be gazetted following the signing of the bill into law included several grants, which through approval from Parliament had been amended to allow for COVID response. This allowed for the repurposing of 7.4 billion in provincial grant allocations and 9 billion in local government grant allocations. Includes the introduction of a COVID-19 component in the HIV, TB, malaria, and community outreach grant. This component comes with additional money for this grant. There's an addition of 11 billion to the local government equitable share and downward revisions on a number of conditional grants to respond to the pandemic. Next slide, please. Right. So this slide is intended to give the committee a picture of just how severe the impact of COVID is on the fiscus. So at the time of tabling the budget in February, we were already in not so good shape. Economic growth was very low. Our financial position had significantly deteriorated. COVID aggravates this. So the economy is expected to contract by 7.2% this left. We see that nationally raised revenue is expected to be 3.4 billion less than what was budgeted for in 2021. The gap between expenditure and revenue as a percentage of GDP continues to widen significantly in 2021, resulting in a 14.6 main budget deficit. Debt service costs continue to increase, as seen in the table at the bottom right, which shows debt service cost as a proportion of main budget revenue over the last 20 years. In 2021, we see debt service costs increase from being at around 15 Rand 19 to 21 Rand 50 in 2020-21. I think, Stephen, we can move to the next slide. I think with the previous slide in mind, we hope that the committee will appreciate why the 500 billion support package announced by the president in April has had to be funded in the way that it is. The president was clear that it will be funded from increasing the deficit as well as reprioritization. So in this case, we would want the committee to appreciate the importance or the need to reprioritize within our existing baselines. He had announced the reprioritization of 130 billion. 30 billion of this 30 billion would have had to come from provinces, particularly from their equitable share. This adjustment budget represents just under 101 billion of these reprioritizations. These come from a variety of sources, including savings realized from activities that could not be implemented under lockdown, and spend funds due to lockdown regulations. So a case example is capital expenditure, where construction was not allowed under level 4 and 5. We're able to also find or identify possible underspending using or based on past expenditure, so past poor expenditure. We acknowledge that the scale of reprioritizations will have an impact on service delivery, but sector departments and ourselves, we applied our mind to projects that could be delayed, projects that could be scaled down with minimal impact. Thanks. Can move to the next slide. Response primarily from their budget, which is largely funded by the equitable share. These reprioritizations are not visible in the amendment bill because we're not taking money away from the provinces, rather they are redirecting within their budget, adjustment budget. They've committed to reprioritizing at least 20 billion, of which 15 will be reprioritized towards improving the capacity of the health sector, and the remaining 5 will go to social welfare services, as well as the provision of quarantine sites by departments of public works. Next slide, Steve. But with local government, the lockdown has meant that municipalities are not realizing the revenue that they would ordinarily be collecting. And this is understandable because there's been reduced consumption of services from both households as well as large commercial consumers. So although we don't have a full picture of the impact on revenue right now, in April, metros reported an aggregate drop of 30%, and other municipalities or your locals reported drops at the range of 40 to 60%. I think we all know that municipalities have been facing some form of financial distress over the last couple of years. The non-optimization of revenue collection has been one of them. So COVID just exacerbates this. But municipalities are facing real pressures or real additional pressures. One of these is a result of economic downturn where people have lost their jobs, they've lost income, and so municipalities are finding themselves having to provide free basic services to more households. They've had to provide for the sanitation of public vehicles as more and more people are commuting to and from work, with the economy opening up, and waste services to enable adherence to the stay-at-home policies and ensuring that households or informal settlements and households in poor and serviced areas have access to water. They've also had to provide temporary shelter for the homeless. This slide provides an overview of how the division of revenue, the adjustment budget. I don't think I should speak too much to this, Stephen, but the problem we're trying to address here is that both provinces and municipalities find themselves in a situation where they have to do more with less. But considering the financial and economic constraints, our response is focused on reprioritizing within existing budgets. I mentioned earlier that provinces will be tabling their budgets. The same is expected for municipalities. One of the principles has been to protect both the provincial and local government. Rather, prioritizations are being made for provinces, and an additional 11 billion is being made for local government so that they're able to maintain their current levels of service delivery while they temporarily are unable to raise revenue. A total of 16 billion with an unconditional grant is repurposed for the response. I mentioned earlier that the gazetted frameworks have been amended to allow for this expenditure. And they've also have to we have also had to reduce a number of grants or suspend a number of grants. So for provinces, This is a total of 7.2 billion in suspensions, and in local government it's 6.3 billion. Next slide. This slide shows amendment bill are illustrated. So at the bottom left there, we see how the allocations are shown in the main bill, where column A shows allocations for the current year, and column B shows the outer year or forward estimates. In the amendment bill, column A is extended to show the adjustment as well as the revised allocation. This is just to maximize transparency. All but Schedule 2 are amended in this way. The bill clauses also include for the creation of additional dates for the payment of the local government equitable share. So these are legislated dates, and we currently have 3. But as I mentioned, that 11 billion is being added to local government, or for cash flow purposes, we may need to spread out the payments or have additional dates. That is it from me. Marumo will take over from here. Thanks.
Thanks, Zeto, and good afternoon, Honorable Chair and Honorable members. Name is Marumo Mage from the National Treasury. As Steve has indicated, I'm the budget analyst responsible for the province. I will start with the changes that were made to the health sector grants. My colleague Zeto spoke about the 15 billion that has been earmarked for health from the provincial reprioritization, as well as the 1 billion earmarked for public works with regard to isolation and quarantine. So in addition to that particular reprioritization, that the colleague has indicated, there's been some additional funding that has been made available for the health sector, and that is about 2.8 billion that has been added to the COVD at a gazetted allocation of 605 million, which then this brings that total to about 3.4 billion. And the purpose of that funding is requirement of the personal protective equipment, the ventilators, the hiring of additional capacity within the sector, which includes the Cuban medical personnel, as well as the responding to the pandemic in general. In terms, there's been also the within the funds within the community outreach services component of the HIV and AIDS, malaria and community outreach grant will be used for the screening and contact tracing for COVID-19. And there were about 10,000 of this community work that grants to deal with this. And within the health facility revitalization grants, to provide additional capacity refurbishment of the health facilities. There's been 298 million within the National Treasury Services grant of the tertiary hospitals. Next slide, we look at the reprioritization that was done within the education grants in order to support sanitization and sanitation at the education facilities. 600 million has been prioritized from the direct school infrastructure backlogs grant to provide for potable water and safe sanitation for all schools that lack 4 billion that has been reprioritized to provide for tracking of water to refill the tanks that have been provided at the schools. Also to purchase the sanitization material, the salaries of the EPWP temporary workers that has been employed to assist with the screening of the learners and clean and also sanitize the school facilities as and when required. There's been 50 million within the school nutrition program, for additional sanitization in food preparation and distribution areas, as well as making provision for the PPEs for the food handlers. 20 million from the the learners with profound intellectual disability grants also to provide for the PPEs and as well as support for education of children with the severe profound intellectual disabilities. Then in order to support the catch-up activities, 30 million from the Med Science, and then there's also 40 million also, 30 is from the Meds, and then 40 million from the HIV and AIDS to provide educational measures in response to the pandemic. Next slide. Then with regard to the other provincial grants, changes that happen to the other provincial grants, 89 million has been reprioritized within the early childhood development grant to prepare for the opening of ECD centers in the education sector. Then there's been 10 million that has been reprioritized within the community library services grant, in order to sanitize the libraries, provide hand sanitizers for the users, as well as making provision for PPEs for the staff working in those libraries. Then 337 million has been reprioritized within the public transport operation grants in order to make provision for the sanitization of buses as well as public transport facilities. 58 million within the mass sports grant to compensate for the sports sectors for the loss of earnings due to the cancelled event. And then lastly, 378 million has been added to the Provincial Emergency Housing Grant in order to swiftly provide for emergency housing to allow social distance or self-isolation to happen for those that are unable to do so as and when required. Next slide. This slide just shows, in a tabular format, the total grants to provinces as well as the revisions that has been made and the amounts that have been reprioritized or repurposed within it. There's been a revision in total of about 3.9 billion from the grants, as well as 7.3 billion that has been reprioritized within the grants to deal with COVID. Next slide. And then the slide, I think, just shows the total. Okay, this slide, moving to the Western Cape, the impact on the Western Cape just shows the total impact on the Western Cape conditional grants. In totality, the grants in the Western Cape were impacted by an amount of 113 million as a result of the reprioritization towards the 100 billion that my colleague has indicated. In agriculture, it was 30 million. They were affected by 30 million, and then the amounts for education, 169. That is it's also related to the reprioritization that I've indicated from the direct into the indirect. Next slide. And this is just the rest of the other grants that have been affected. The human settlement grant, the 246. There was an addition from the 3.8 billion that I've indicated of about 552 million. Next slide. Okay, I'll end it there and hand it over to my colleagues to proceed with local government. Thanks.
Thank you, Marumo. My name is Pritima Wongo, not Pretty Lang to you all. I'm the budget analyst responsible for Western Cape in terms of monitoring conditional grants, and I'll be taking you through the changes for local government. So the Division of Revenue Amendment Bill makes 20 billion available to local government to spend on the COVID response in the 2021 financial year. 11 billion of this is added to the local government equitable share, and a further 9 billion is available within the conditional grants transferred to municipalities. These funds have been added through the local government equitable share. They are necessary to release funding for the pandemic response. Grants that are likely less to be spent this financial year due to construction and other delays caused by the lockdown have been revised downward first, cannot be delayed and projects can be postponed for the next year. Next slide. In terms of the additions to the equitable share to respond to the COVID-19 pandemic, this is to assist municipalities in this response, where 19 billion has been added to the equitable share. These funds will allow municipalities to maintain existing services despite a temporary decline in revenue collections, as mentioned earlier. They will also cover some additional expenses incurred, including temporary shelter for homeless people during the lockdown. There's been an increase in the basic service component. This is in terms of the two components of the equitable share that have changed. The basic service component, which amounts to 7.5 billion. As a result, an additional of 1.4 million poor households can be provided with free basic services, and up to 10.4 million households in this budget if they become indigent as a result of loss of income during the pandemic. And this just shows the increase of the local government equitable share per municipal type, where metros receive 27%, followed by mostly rural municipalities and then small towns. Next slide. And this is summary to the local government allocations. It is important to note that local government conditional grants amounting to 4.6 billion have been suspended in the 2021 financial year. This includes 3.6 billion from direct conditional grants and 1 billion from indirect grants. This suspension will enable the funding for the COVID response, and amounts of 190 million and 4.4 have been reprioritized within the Integrated Urban Development Grant and also the MEG respectively. And for metropolitan municipalities, 2.3 billion has been reprioritized within the Urban Settlements Development Grant. This amount will fund the provision of water and sanitation. And for the 10 cities that receive the Public Transport Network Grant, the sanitation of public transport facilities is funded through the reprioritization of 1.1 billion within the grant. And lastly, 401 million within the direct regional bulk infrastructure, and also the indirect regional bulk infrastructure, it was 689 million, and within the water services infrastructure, the municipalities will be able to purchase and install water tankers and tracking of water to refill. Next slide. This just shows an overview of the equitable share within the province. Next slide, where it increased to, next slide, to 6.4 billion in the current financial year. The adjustment is 7 in terms of the equitable share within the conditional grants. It is important to note that the reduction of the public transport network grants include a reduction of 1 billion from the City of Cape Town that was allocated for a project funded through the budget facility for infrastructure that the city will not be able to spend in the current financial year.
Thank you very much, Chair. That concludes the presentation. And I must just apologize to my colleague Priti there for using her maiden name. That's just a slip back in time. That gives you, and I must just emphasize that what we've presented here is just an overview of what is in the Division of Revenue Amendment Bill. So there's more detail in the bill itself, and we've provided the link there. And then also we keep referring to these reprioritizations in the grants and the gazetted frameworks that provide the rules and conditions for those reprioritizations in the grant frameworks. Those gazetted frameworks are also on the Treasury website at the link provided. Thanks very much, Chair. That ends our presentation.
Thank you. I'm going to open up for questions from members first, before we go to the public section of our meeting. Honourable Nkondlo. Honourable Nkondlo, you had your hand up. You can go.
Thank you, Chairperson. I've got a couple of questions. Let me thank the presenters. I think first two, I think are just comments. I'm interested maybe from the colleagues of Treasury to just an out of the norm reprioritization or budget allocation principles that would have applied to this particular effect that we've got COVID. What would be those, given their history and how they had to contend with such adjustment? That's the first issue I'm trying to understand, and I appreciate, I think, the last few slides that provides some sense towards the province, because I would think, because I've seen the similar presentation that was done with National Treasury and the Select Committee, that because you are coming to province, you would then nuance more, because our interest is really to understand, all of this in context to our province, which is why the consultation is with the province. Now, let me get to my questions, Chair. My question one is that I'm wanting to understand, can the colleagues provide us what is the criteria being used, in particular to determine what they term repurposing or reprioritizing, the funds both in provinces and in municipalities. I think the colleagues spoke about, they took all the necessary, considerations of ensuring there's minimal impact. What is that, and who determines what is minimal impact? And I'm raising this because I think earlier on in the presentation slides, we are told of a 7.4 billion plus a 9.9 billion from the province and local government billion rands that has been repurposed. And I'm trying to understand whether that amount, is the same or different to the one that also is mentioned as a downward adjustment of the 7.2 billion from province and 3.6, which amounts to 10.8. Are these two amounts different, as repurposed funds? Then another question is, on the revenue of municipalities, we are told that some of the municipalities, their revenues have dropped. Can you inform us in terms of our province, are there any of those municipalities, including those that you indicate have been under financial distress? Which are those municipalities specifically? And the other one, Chair, is that when I think we are told of a 15 billion of reprioritize for health, and also the community outreach grant, I want to understand, would this include, I think, some of the pressures that we've seen, on the old infrastructure, that is health facility infrastructure, that has been there even before COVID, and what's going to happen to those? Because I am sure both in terms of health facilities, which is clinics or hospitals, including schools, we had these that have been waiting on lists. So what happens now with the repurposing? Do they go back, to the end of the list? Are they brought forward? One considers that, monies now have been reprioritized in building, whether new clinics or in refurbishing or maintenance of current clinics. My last one, Chair, is that we're told about the direct and indirect 4 billion. I didn't get that one correctly. And I want to understand the 1 billion it is said is infrastructure from the city of Cape Town. Can you just explain what exactly is this grant for, and why was this grant not used by the city of Cape Town in terms of the reasons that were provided to you? And are these reasons sufficient? Because I was part of the conversation, which I think both National and Select Committee raised. How do we deal with the issue that actually emanates as an unintended consequence of punishing communities that needs these grants as we are proposing because of technical and administrative reasons? How do we deal with such in relation to this one of City of Cape Town? Thank you, Chair.
Thank you. Honourable McKeith.
Thank you, Chairperson. May I continue?
Yes, you may.
Thank you, Chairperson. I'm going to start on slide number 11, if I may. I just want to make sure that I get my slide number properly. Slide number 11, yeah. The additional funds, 2.8 billion, has been added to the COVID-19 component, to the HIV/AIDS, malaria, etc. And then below that bullet point, this component spending for PPE, which I can understand. And then the last few lines, I just want to clarify, and hiring of additional staff, including the Cuban, I presume that that word was misspelled, or spelling error, medical personnel to respond to the pandemic. But it's for the Cuban American personnel, and I presume it includes their accommodation costs, their transport costs, because these guys obviously, now making assumptions here, needs to get from the hotel to the hospitals that they stay. If we can just get clarity. And then when you refer to this as 2.8 billion has been added to the COVID-19 component, what 6.5 billion, 6.5 million, 2.8, if we can just get in a breakdown of where it is in the big book, because I couldn't find a clear breakdown of that. It'll just assist me before I ask further questions on that. And then on slide number 19, with the last bullet point, further funding can be freed up. And then it says, if National Treasury has written to SALGA to formally propose this, what is the status of that? Let's get what is the latest on that? And then my other slide on the spending reviews, which National Treasury is going to undertake. What is the when and where is it taking place, and what methodologies are they going to use before they implement that? And then on the detailed budget on National Treasury's website, there's I picked up, I think it was 298 or 293 million rand that was reallocated or adjusted for the Defence Force. I think it was air defense or something that I picked up on, but again, it wasn't clear what it was for. And the reason I'm asking this particular question is because provinces, and we talk about for additional personnel early on, like I said on slide number 11, I'm in the Western Cape, as you know, they've now got Brackenbait, Sawn, Kral, CTICC, with hundreds of staff members. And the reason I'm when money goes towards items that are not properly explained, like 300 million for air defense, in particular because it's air defense, then it raises to my mind questions where province million for air defense, and I'm just keen to know what that was for, because provinces are short-changed on money, and I mean, you've gone through this now, so we do know that they are short-changed. Because, for example, when the president was here 5 weeks ago, he said that there's no issue with money. Yet we find provinces are shortchanged now, and they have to employ more people. Like I said, CTICC, Brackengate. So we really need to understand what's that was for, particularly when it comes to several of the budget votes. Chairperson, can I leave that for now, just because, particularly on that slide 11, I just need to, for my understanding, so I can get an idea as to where the money is going and why additional funding is going to, and what percentage of the Cubans, so what are we paying for? Thank you. I'll leave it for now at that.
Sorry, I keep getting kicked out. I'm back now for the third time. I'm not too sure where we are now. Last I heard, Honourable Mackenzie speaking about 239 million, sorry.
Yes. Yeah.
Okay, are you done, Honourable Mackenzie?
Yeah.
Treasurer, have you captured Honourable Mackenzie's questions while I got lost in the connection world?
I'll come back later if there's more. It's fine.
Okay, Honourable Dugmore.
Thank you very much, Chair. I would just make a disclaimer. I joined the session slightly late, just because of some connection problems. I want to thank Wasima for helping me to get back into the session. But could I just ask the National Treasury, in terms of the source of the additional funding, if they could just explain what the source of that additional funding is. There's been quite the whole notion of quantitative that can be applied in a situation like this, whether to a limited or a greater degree. I'm sure members of the National Treasury would have seen the debate that is currently underway in regard to a former Treasury official, the views of the Reserve Bank governor, and so on. So I would just like to ask, firstly, what the source of the additional funding is. Secondly, what is the Treasury's view towards quantitative easing at a time such as this, during the COVID-19 pandemic? And then my next question relates to the issue of the actual new money that is made available to the Western Cape in this process. Then I would also like to ask that in regard to the situation that local governments find themselves in, I think Member Nkondlo has asked, and I would also like to get the view on exactly which municipalities in the Western Cape, in the view of the National Treasury, require support, and to ask what is the National Treasury's view on local government budgets where, for instance, the tariff set by municipalities for unoccupied, vacant private land, and whether the Treasury has a guideline in regard to the approach that local municipalities should be adopting. I'll give you an example. Within the Knysna municipality, for instance, the tariff set on unoccupied vacant land compared to the neighbours of George and Bito, that's Plettenberg Bay, are substantially less. And does the Treasury have a view in regard to that as a possible way of generating extra revenue? And how, in particular, is Treasury advising municipalities to improve on revenue collection at a time like this? And what has been the approach in regarding the municipal budgets and the guideline in regard to the level of increase, whether it's inflation linked or a certain amount less than inflation? And then lastly, on one of the slides, there's an indication there of impacted on by COVID, but I didn't see in that slide any particular allocation towards artists in the cultural sector who've been very, very badly affected. As we all know, that performance by artists is probably going to be one of the last sectors that would be allowed to operate. I'm not even sure under level 1. So if artists, and then if they could also explain in regard to tourism, which is another sector which pandemic and also employs a lot of people, what is the specific allocation nationally as well as to the provinces in regard to supporting the tourism sector? Thank you.
Thank you. I want to take Honourable Makamba Bocha, and those who have already asked questions, if you could just lower your hands unless it's for the next round. Honourable Makamba Bocha.
Thank you, Chair. My question is Honourable Nkondlo. I just want to ask a very simple question, a general question. in terms of the budget allocation. I want to know from the National Treasurer what constitutes the budget allocation. For an example, I'm just going to make an example of municipalities who are declaring underspending by the Auditor General. So what is the correlation of the budget, the budget allocation? So what is the process in that? So what constitutes their allocation of budget to municipalities? Thank you.
Thank you. What I want to do is I'm going to allow Treasury to take those questions first, because the hands I currently see are people who've already asked questions, and then I'm going to wait for the next round for that then. Honorable Treasury, you can direct who will be answering what.
Thank you very much as I can, and then ask my colleagues to come in as well. It's a lot of questions, so I hope I don't miss any of them. The first question was an interesting one. What would be an out of the norm reprioritization principle in this budget? And I think it's helpful in talking about just how unusual this COVID adjustment budget is, because it is not, we're quite used to presenting to you that we've been in a difficult financial situation, a difficult economic situation, and we've had things here is a much more severe economic situation and a much greater need for additional public spending on something we hadn't foreseen, right? But what makes it really different is that this is also temporary. So what we're presenting here in these reprioritizations is not a change over the medium term. So normally what we're saying is that we're making a series of budget changes in order to ensure that our future path is fiscally sustainable, our debt trajectory, etc. We will still have to do that. We'll have to do that in the medium-term budget policy statement. We'll have to show how we can rearrange spending to do that. But in this budget, what is different in the reprioritizations is that we're dealing with an emergency. So what that means is that we can reduce saying that we're changing government's priority. We're not saying that we're taking away from that priority. All we're saying in this budget, so for example, when you see what it's saying is that at the moment there is something to do is just pause for 1 year. So we would normally, but we're able to do that because it's this once-off. In some of the deliberations, we were talking even potentially about bigger large infrastructure programs, etc. So what we've tried to do is structure here a kind of a compromise where we still spend on some money on those important areas, but obviously the whole situation has been overtaken by repurposed for and reprioritized towards the COVID response. The word repurposing, and this is particularly within a conditional grant, we repurpose funds. So what that means is that we're using the funds that are allocated in a grant for one set of things that I think we'd be familiar with. So for example, in the municipal infrastructure, building water pipes, etc. We've repurposed 10% of that grant for providing sanitization for public transport. So that's providing hand washing facilities, hand sanitizer at taxi ranks, at bus stops, cleaning taxis, etc., making sure that public transport is as safe as possible so that people can return to work. So that's obviously not something that is normally within the mandate of the MIG. What repurposing means is that the same amount of money is still transferred to that municipality in that same grant, but the grant rules, we've put in extra grant rules in those gazetted frameworks that allow it to be used for this additional COVID-related purpose, as well as it's kind of the rest of the funds in the grant are still used for their normal purpose. So I hope that explains that one. Then the revisions, I can't even read my own handwriting here. The Western Cape municipalities, there were from both Honourable Mkondo and Honourable Dugmore, there were these questions about which Western Cape municipalities are in distress. I don't think it would be appropriate for me to kind of go into names of municipalities here for two reasons. The one is simply that all municipalities have been affected, right? So every municipality in the country. The other reason that I don't want to go into too much detail is that the extent of that knock on revenue is still to be determined in the final analysis. So the numbers that we showed you, the very scary numbers that Zetu was talking through, are numbers under a level 5 lockdown, which meant that most municipal offices were closed, most companies were closed, etc. So it's not altogether surprising that there were a lot of unpaid bills then. It's also not surprising that when households are facing the potential of a job loss or change in income, that municipal bills are something that they don't pay. One of the honourable members asked what our advice to municipalities is on the revenue collection. Our advice to municipalities on the revenue collection is to progressively tighten their revenue control. So to be patient with their customers and to say, look, where you're late in payments, etc., let's make a plan, let's accommodate you as far as we can within our existing policies, but to collect those revenues. And so we hope that some of those revenues that haven't been collected will still be collected as we go forward. And so in that sense, the final impact and how much of this is kind of permanent and how much of this was a temporary issue is still to be determined. So I think that's on the municipal revenue side. The question around the long-standing projects in health infrastructure, I think that's a good example of how this reprioritization works. It means that there are some projects in infrastructure, in both school infrastructure, health infrastructure, roads infrastructure, that will be delayed for a year. Because this is such an unprecedented crisis, it means that we can't do everything that we had planned to do originally. I mean, that's certainly true in all of our personal lives, that this pandemic has meant that we can't proceed with our plans for the year as they might have been in January. It's true for government as well. We've had to delay some of those, and some of those are very unfortunate. But I think we'd all agree that ensuring that that 1.1 billion in the health infrastructure grant, that's used to ensure that there's the maximum number of beds available for ward capacity right now in this pandemic, is the right priority. The difference between the direct and indirect grants are simply those grants where we transfer the cash to municipalities and they spend it. Indirect grants are grants where national government spends the money on behalf of a municipality. So particularly in the case of the INEP Eskom grant, the electrification is done by Eskom on behalf of municipalities. There was a question about the reduction on the public transport network grant in the city of Cape Town. So this is for a very specific project. This is for the extension of the MyCity network. I think it's phase 2A of the MyCity network, and we had funded this. There was just over R1 billion allocation to that particular project within the MyCity network because of a number of problems, both technical and within the municipality. There have been delays in that project, and so we have talked to the city. We've engaged with them, and we established that actually they wouldn't be able to spend that amount in the 2020-21 financial year. And so we said, well, rather than a government borrowing that money and transferring it to the city and the city not spending it at a time like this, I mean, that would just be crazy. So I think we had a sort of an agreement with the city through that consultation that it would be better to declare that as part of the savings here and then fund that in a future round of the budget. Honourable Mackenzie asked for a little bit more detail on the COVID-19 component. Honourable Mackenzie, the breakdown of the COVID-19 component, the allocation per component, page 60 of the Division of Revenue Amendment Bill, that's page 60. The Western Cape's allocation from it is 588 million rand from that in that component. Of that, you also asked about the Cubans. So for the Cuban personnel within that COVID component of 3.4 billion, there's an allocation of 283 million rand for the salary costs of those Cuban personnel. There was a question on the status of the wage negotiations. Well, of our suggestion, let me put it that way, of our suggestion with respect to salary increases. Sorry.
Yes, Honorable Kenzie.
Chairperson, if I may, can I just clarify the question quickly, if you don't mind?
Clarification, yes.
Just on the formula used, so I do apologize to Treasury, the formula, the determined formula, what was that formula used for the allocation of funding to provinces, if you don't mind?
Okay. This is for the COVID-19 component.
Yes.
The formula there, the allocations were determined based on two factors. The one was the population size. So a little bit like what we do in the health component of the provincial equitable share, we were using the uninsured population, so the population that depends on public health services, although we did include about 20% of the insured population as well. So it's a little bit larger than your normal uninsured population because we recognize that some people with insurance also spill over into needing the public health sector. So that was the largest part of it, that accounted for 70%. And then we also, and this really benefited the Western Cape, the other 30% was based on caseload. And that was caseload in the middle of June when we were determining the final allocations. So that's why you will see the Western Cape get a larger increase through that component than almost any other province. Gauteng, which had an increasing caseload at that time, but it obviously has more than twice the population of Gauteng, is the only province that gets a larger allocation. But I mean, the Western Cape gets a larger allocation than KwaZulu-Natal, for example, when KZN has clearly a much larger population. So that reflected the kind of disease burden at that time. We didn't, if you want to know what's based on disease burden, is because we were very cognizant that the disease burden is going to change as we're seeing now. You know, the number of cases in other provinces. We may have to, you know, in the next adjustments budget in October, we may be wanting to add more money to other provinces, depending on how things change. Okay, on the municipal wages issue, just to be very clear here, National Treasury is not a member of the South African Local Government Bargaining Council. So we're not a party to the wage agreement, unlike with national and provincial wages, where our sister department, DPSA, is the government representative there. In the case of local government, SALGA is the employer representative. So when in our engagements with municipalities as part of preparing for this budget, a lot of municipalities said to us, look, we are, and I think this goes a little bit to Honourable Dugmore's question about our guidance on the extent of tariff increases. A lot of municipalities were saying, look, we're trying to keep our tariff increases as low as possible. We see inflation coming down to kind of 3% or thereabouts, and we would like to keep our tariff increases in line with that. But what is happening, but we're facing a 6.25% wage increase, and wages in general account for almost a third of municipal expenditure. So if wages are going up by that, you know, it puts a lot of upward pressure on municipal budgets, on tariffs, especially at a time when municipalities are unsure of their revenues. So that was cited to us as a cause of pressure in the system. We looked at the bargaining agreement, verified that it was in fact 6.25% that was binding, But we also saw that in that wage agreement, there is a provision for exemptions to be granted. There is a mechanism, there's a whole long section, it's section 11 of the collective bargaining agreement that allows for exemptions, including exemptions because of unexpected economic hardship is the phrase. And we thought, well, you know, as Zetu presented in the slides there, this is the current economic downturn is orders of magnitude larger than anything we've seen in the past 25 years, much, much bigger than what we saw in the definition of unexpected economic hardship. And so we wrote to SALGA and we said, look, we think that this is the situation. We think that you should take this forward as the employer representative in the local government bargaining council. That is what SALGA has done. It is now in the bargaining council. We were asked to come and present, you know, just for information to the bargaining council, and that process is now in the bargaining council, which we're not members of. So I can't kind of really give you more of an update than that. It's a bargaining council decision whether that exemption is granted or not. On the spending reviews and the methodologies there, we do have established methodologies and in fact on the GTAC, the Government Technical Advisory Center website, you can see some of the past spending reviews that we've done. Because of time pressures, those expenditure reviews can be quite time consuming. So we may be looking at sort of mini versions or faster versions to respond to the time pressures with drawing up the budget. I think it's too early to say definitively at this stage. Ask us when we're presenting the kind of the next budget, or at least the medium-term budget policy statement, and we'll be able to give you more detail on that. I can't respond on the issues around the Defence Force. That's national spending that's not really part of the Division of Revenue Bill, and I'm not familiar with the details there, and I don't think the team will be either, because none of us work with the defence budget. So I beg your pardon on being able to answer that one. Honourable Dugmore asked about the sources of additional.
So it's not a new aeroplane.
Sorry?
It's not a new aeroplane.
Honourable Mackenzie, let us allow for the questions to be answered.
I don't know anything about new airplanes. It's beyond my pay grade. Okay, the sources, the additional funding. So this budget is funded, and I think Zetu kind of took you through these slides, and I take Honourable Dugmore's point that he might have not have been there at the beginning of the meeting. But this budget is largely funded through reprioritization. So in President Ramaphosa's announcement of the various economic packages and relief that the budget then makes good on, President Ramaphosa did in cutting very deep in planned expenditure to reprioritize to meet the kind of pressing COVID challenges. And so that's most of the spending in this budget is funded through reprioritization. There is also a net increase in government spending beyond the expenditure level, the expenditure ceiling that we set ourselves in February. So there is an increase in government expenditure, but that is funded through borrowing from the market and from multilateral finance institutions. It's not, QE doesn't come into it at this stage, and I think I'm going to stop myself there. The new money to the Western Cape in this process, I think that 552 million rand addition that brings the COVID-19 component to the 588 million, I think, in Cape. I think the approach to rating vacant lands that Honourable Dugmore raised is a fascinating question, and it's as much about spatial development incentives as it is about municipal revenue, I would say. But that is not a Treasury. His question was about what the Treasury's advice to municipalities is on those rating policies. And I should just clarify, that the Municipal Property Rates Act is the domain of the Minister of Cooperative Governance and Traditional Affairs, not the Minister of Finance. There. So we can't really, so it's not the Treasury that would be issuing guidance on property rates. As surprising as that may be, given that it's a tax. The advice on revenue collection, I think we've spoken to that already, the progressive recovery of those revenues. And then there was a question on the compensation for artists and also for tourism. We highlight the compensation for sports persons in this Division of Revenue Amendment Bill because there is a sports mass participation grant that already pays some salary costs in the sports sector. And we've kind of, in this adjustment budget, what we've done essentially is broaden that. And so within that grant for sports persons is only a part of the 150 million that the Minister of Sports, Arts and Culture has announced as a relief package for the sector more broadly. So this is only one part. The support to artists is within the national budget, so it's not part of this bill. And similarly with tourism, the tourism relief, there is tourism relief in the national department, again, not in this budget. There may also in individual provinces be additional relief both to sports persons, artists and the tourism sector. And then lastly, Honorable Boycha was asking about what two individual municipalities and whether it was linked to underspending. The short answer is that it's not linked to their underspending. So because we're responding to a crisis here, we recognize that even municipalities that may have performed badly, still have genuine spending pressures, and that this relief needs to be provided across the board, so every municipality benefits in that way. What we've also done, because this is an emergency situation, we felt some complex new system, new funding rules, new whatever, and new allocation methodologies that nobody understood could cause a lot of confusion and conflict in the system. So what we said is we tried in an emergency situation, you try and use existing channels. So that's why we're transferring the money through the local government equitable share. And it also means that we're using allocation formulas that are well understood and already approved by Parliament, etc. So we're not kind of reinventing the wheel in the middle of a crisis. Chair, I hope I've covered all of the questions. I don't know if any of the members of the Treasury team want to come in to supplement anything or catch anything I've missed.
I think you did cover it all, or at least for those that I was in the meeting for. Members, all the questions covered. Can I take the next round of questions? I see Honourable Mackenzie and Honourable Makamba Bocha's hands. Honourable Mackenzie, you can start.
Chair, that was earlier on, but it's fine. You can continue with the other members. I just want to get my notes quickly.
And Honourable Makamba Bocha. Otherwise, I'll pose my questions so long.
It was the same
thing.
Okay. Yeah.
Okay. Honourable Nkondlo, I see your hand. Honourable Nkondlo. Honourable Nkondlo, can you hear me? Or
yes,
have I left the
Chair.
meeting?
Yes,
Okay.
I can hear you.
There was a meeting again of some sort. Okay.
Apologies. Chair, I got the response, I think, on the relationship between the budget allocation and spending. I'm sure we will have to agree this continues to be, one of the tricky points of public finances, because indeed, I think with underspending and all of these things and money is being repurposed, it leaves much to be desired as an oversight body when we consider, all the issues of reprioritization in that environment. But I will leave it at that. The question that I wanted as a follow-up, Chair, was around I think in one of the slides towards the end, there's an indication there of the monies that are given to the municipalities, which I think Treasury says, the municipalities will then be allowed to decide on the spending of that money. I think it just raised a bit of a concern from where I'm sitting, whether they aren't particular, and I understand the MSCOA and all the general frameworks, but I think what is my concern with this particular principle, I think it's on slide 19, it says each municipality will determine how best to use the funds to respond to local pressures. And this is where I'm saying, it's very worrisome, given once again what we've been raising about, the capacity to spend, which has been demonstrated by the Auditor General's reports around, once again, we leave, an open window of saying municipalities will determine how best to use the funds. I think let me raise that. And lastly, Chair, just to get a confirmation that what Treasury is saying, that it's only 10% of these grants, which is said to have been placed for repurposing for the spending towards COVID-19. Is if Treasury can just confirm if that is. Thank you, Chair.
Thank you, Honourable Mvimbi.
Thank you very much. Thank you very much, Honourable Advocate. 3 issues. I thought maybe during the response I might have picked them up, but that's why I think maybe let me come in and get some more clarity on it. Just on this refunding, rearrangement of the funding, especially for provincial government. I know that most of the presentation was really based on guidelines, what were the guidelines that we use in terms of reallocation. But I just want to check whether will that still be at the discretion of the province to make the final determination as to how they want to make that funding. How do they want to make an expenditure on this repurposed funding? Also aligned to the issue of provincial funding. I know that with all this provincial funding that has been taking place, it has been reported, especially in the media, that other provinces are actually making already. When I know there's been some outcry, a lot of outcry that funding to them has not been forthcoming, especially by various provincial ministers. Maybe it will be helpful if maybe the Treasury can assist us whether has some of this funding been made already to provincial government, as it's sometimes alleged in the public discourse. But lastly, it's regarding the formula that has been used. I know that the issue of I would like to maybe get a comment from Treasury, especially the formula on intergovernmental grant. I know there's a lot of discussion, there's a lot of questions around the issue of the formula. I want to check maybe how far is the Treasury in terms of finalizing the issue of the formula for equitable shares.
Thank you, Honourable Dagmore, and then after that I'm going to throw my questions in, Salam.
Thank you very much, Chair. Chair, I just wanted to check, I've been having problems with around that member in Kondlo asked around the specific municipalities in the Western Cape that were considered to be
Yes, I do remember being on for that one, but would you like me to just ask Mr. Kenyon just to repeat when he does the other answers?
Yeah, thanks, Chair. Yeah, just the names of those municipalities. Thanks. Sorry about that.
He didn't mention the names, but he did give you an answer. So I'm just going to ask him to repeat his answer for you then. Okay,
Chair. Well, possibly if the National Treasury is not aware, I presume we have people from the Provincial Treasury as well who'd be able to answer that question.
Okay, I'll put that to him as well. Mr. Kenyon, % thing of the repurposing of grants for COVID.
Member Barton. Look, I think Member Barsman should come back anytime soon. In the meantime, would National Treasury then respond to those questions that were raised?
Sure, and I'll stop as soon as soon as back. I think maybe just to start with this question that I was asked to repeat for Honourable Dugmore. I mean, what I was saying was that there is a lot of uncertainty and went into a little bit of detail about that, about the exact revenue implications for each municipality, because there's a lot of that revenue that should still be recoverable, and we've recommended that. So it's not, you know, a municipality that is in financial difficulties right now might not be in the longer term. And so I don't think it would be prudent for us at this, for me at this stage, especially from National Treasury. Remember that National Treasury does not have direct oversight over all of the Western Cape municipalities, to express a view that says that, you know, that names of municipalities that are in financial distress. But as you say, the Provincial Treasury, Anthony, is on the call as well. So I don't know whether the Provincial Treasury would want to speak there. But I think the other point was just that all municipalities have been negatively affected, and that often what has happened here is that as soon as, you know, municipalities that were in trouble before are worse now.
Okay.
Yes,
Well,
Chairperson,
okay.
you can continue.
Okay, thank you.
You will just responding to
continue.
Member Dugmore quickly, and then Anthony from Provincial Treasury is likely to come in just to respond to Member Dugmore. And then I think he needs to respond to
that, and then I'll come in afterwards.
Okay. Ms. Kenyon?
Sorry, I was done there. I thought the chair was going to continue, or unless Anthony wants to comment at this stage.
Okay, perhaps Anthony can come in, and then the chair can take over after Anthony has spoken. Thank you.
Look, I would actually align to what Stephen has mentioned earlier on, and given that, you know, that we do not have a full cost estimate, but there are quite a few of them, and we can share it with the members, basically a list of where we are currently. But as Stephen mentioned, actually, that it's still early days, but when we do the cost coverage ratio, the current ratio, and the liquidity ratio of a number of municipalities after 3 months, it actually poses basically you can see from those numbers actually that there are quite of them actually that would have an issue with regard to either the liquidity or cost or the cost coverage basically of that. But I think we can share the list actually of where we are after 3 months, and I think the point is, as one actually would consider, it is not a static point as we speak now, Member Dugmore. But where we're sitting with, actually, we can see actually that the signs actually are almost emanating actually from the stress that municipalities under, and I think we can probably share that particular with you, with the committee as well, because it's quite an extensive list of municipalities that are really feeling the strain. But as mentioned, at this point in time, actually, it's still a moving target.
Okay, no, thank you very much. Through the chair, it would be appreciated, Chair, if our Provincial Treasury could provide the members with that working document. Thanks.
Okay.
No problem. We can add it in the resolutions. Can I pose my questions now before I get kicked off again? Yes, Mr. Kenyon.
Chairperson, Chairperson?
Sorry.
I'm not
yes,
sure.
Ricardo?
I do apologize. I think I'm not sure. When you were cut off, Member Nkondla made some input. I'm not sure if she was just making input or Mr. Kenyon was still going to respond to that just before you continue.
Oh, okay.
If Member Nkondla can just give clarity on that, which will allow either Mr. Kenyon to respond or yourself to continue with your set of questions. Thank you.
Mr. Kenyon?
Oh,
Mr. Kenyon, can you hear me? There we go.
Yes, I can hear you. Sorry, which question do you want me to reply to? All the questions that were asked so far before you come in, or I'm just a little bit.
No. The member Nkondle spoke, she made a comment and she also asked the question. She spoke about the underspending to municipalities and reprioritization. And then she spoke to slide 19 with how municipalities are able to decide to use their own funding, the capacity to spend, AG reports. And then the next she asked about the 10% of grant funding set for repurposing for COVID. And she wanted to find out about that.
Okay. I mean, the broader point about the reprioritization. The question for clarity was about whether there's only 10% allowed for reprioritization. That's not the case. So the amount that's repurposed rather within each grant is different. So on this slide, you can see, for example, within the municipal infrastructure grant, the repurposing is around 4.4 billion out of a 14 billion rand grant. So within the MIG, there is 10% that is for sanitization of public transport. There's another 10% that's for urgent repairs to infrastructure. So we normally would say that that kind of crosses the line between maintenance and new investments, and that the MIG wouldn't allow that. But in this case, we're allowing 10% for that. And then there's also money that we expect municipalities to reprioritize towards urgent water and sanitation projects, which it gets complicated. In a way, those would be allowed in the MIG already, so in a sense it's not kind of repurposing, but they weren't the planned projects. So we're expecting, for example, that a roads project would be taken off a municipality's MIG project list for this year in full, which would have been a project, which could have been a MIG project anyway, but wouldn't be. So the percentage within MIG is quite a lot bigger than 10%, and the same with the size-fits-all approach across the grants. It's tailored to each grant, and we've worked quite closely with the sector departments in drawing this up. And the same is true on the side of the provincial conditional grants. If you look at the repurposing here, I mean, it's a very large repurposing in the education infrastructure grant. So that's really, I mean, of the 8.8 billion that remains, half of that, or just over half, in fact, is repurposed for COVID related. So we really expect school infrastructure spending to be mostly COVID related spending. But within the school nutrition program, for example, it's only 50 million because that's providing PPE, sanitization for food handlers, etc. So we're estimating a much lower reprioritization there, although the grant rules there have also been changed so that when during a lockdown period, meals can be provided, funds from this grant can be used to provide meals at locations other than schools. But it's up to the basic education department and the National Basic Education Department and the Provincial Department exactly how that's going to work in each circumstance. What we've tried to be with the grant frameworks is try to be as enabling as possible. I mean, at this stage, none of us knows how many days there will be in the school year, for example. So it's very difficult to set very precise rules for things like that at this stage. And so the approach we've taken is to try and be enabling. Of course, that does mean the flip side of that is Honourable Nkondlo's point of discretion. And we have to have some trust in the system about how those funds will be used. And I agree with you. I'm also concerned in the case of some municipalities about how they will use those funds. And I think you saw in the Minister of Finance's speech his warning about people misusing funds, and he also made a call to the public and to legislatures to watch closely what's happening. I mean, all of these municipal budgets are publicly available. They're public documents, and the adjustments, this Division of Revenue Amendment Bill that you pass, that we're hoping that Parliament will pass, will enable these changes in the transfers, which will precipitate. We really hope that that kind of sunlight and transparency is the best disinfectant. for making sure that the tsotsis aren't the ones that end up benefiting from the funds. I hope that's covered the question, Chair.
Thank you. Okay. Mr. Kenyon, the reprioritization, it's a very fancy English word, because when the 20 billion rand was announced for across provinces, it seemed as if, okay, there's going to be 20 billion rand for the COVID response. And no one was at the beginning informed, oh, by the way, this 20 billion rand provinces must go find themselves in their budgets. It's throughout the process that people found out, and ministers got away, and we found out in the budget, in the division, for example, that actually, instead of decreasing the equitable share or increasing the equitable share, not only are we getting a 0% adjustment, but in our own budget, we have to now go find the money from programs that we would have had and take that money for COVID. Whereas the understanding was actually that we were going to get money and that we would, as provinces, get our respectable shares. So even if there's no increase in the equitable share, for example, the Western Cape funding that's reprioritized, which is on page 5 of Division of Revenue Amendment, is just over 2 billion. And just over 1.5 of that is for the health, and then the other 512 is for the other sectors. And then similarly, when you look at the local government amount, on page 14 of the Division of Revenue Amendment Bill, you see obviously, and you've indicated that provinces are going to get 11 billion. But it was also indicated by the president previously that local government's going to get 20 billion. It's only later that we found out that actually we are going to give provinces 11 billion rand in increase in the equitable share, but the 9 billion you have to go find in your own budget. So programs that local government would have had, they can't have, because they have to use that money for COVID. And that's irrespective of the money they may have already used or are going to also from their own reserves use. And the Western Cape specifically from that 11 billion rand only got 721.7 million rand for local government in terms of the equitable share. And then, for example, when you look at the grants, if the only 2 grant allocations to the Western Cape that increased, the one was a specific grant allocation for drought relief, which is 25 million, and which is wholly inadequate for the drought relief in the Western Cape, although, you know, any money is money and we're happy, but it is wholly inadequate. For example, Eastern Cape got 35 million, for example, for drought relief with the application. And then you get to the second increase of a grant to the province, the Western Cape, which is the health one. And that one specifically is 552 million and 220,000, if I'm correct, on page 19 of the bill. But the one question I was actually going to ask you was about the Cuban doctors. And my understanding was that National was bringing in the Cuban doctors for South Africa and are going to provide it for provinces and essentially pay for them. And the provinces weren't going to fit the bill. But you've just said earlier today now that of the 552 million rand in the HIV, TB, and malaria and community outreach grant, which is a conditional allocation to us, and the only other allocation that's increasing in terms of grants, that 283 million is just going to be for salary costs for the Cuban personnel. Salary costs which could have gone to actually appointing doctors and nurses in the Western Cape that may or may not be unemployed, or even from other provinces who want to come work in the Western Cape, for example. And you indicated that the rest is for ventilators. Yes. The Air Force question you've answered, but I think I'm going to have to probably ask that we put that into a resolution, because although this is not the adjustment appropriation budget, the two speak to each other. They are read in conjunction. And under that defense vote in program 4 on page 9 of that bill, there's just one line saying 239 million rand for air defense. It doesn't say the program, it doesn't say what it is. And I cannot imagine what the air defense would have needed between February or March in the beginning of this year, and now that they needed such a big increase, if maybe it's not to go and fetch the Cuban doctors. The other grant amounts is all decreases. The education infrastructure grant is decreasing by 159 million rand. And that's irrespective of the money that education has already used in its infrastructure grant for COVID. So it is getting a cut. And then provincial roads maintenance is getting 161. That is definitely almost a 20% cut. The CASP cut in agriculture is getting a 21 million cut. That's about a 20% cut. The Lima Letsema projects grant is 9 million. That's about an 18% cut. HIV and AIDS in the basic education vote to the Western Cape is a 4 million. That's also about 20 to 25. I'm making an estimation there. Basic education, maths and science and technology grant is 5 million out of the 35 that we would have had. And then you get the two human settlements grants, the human settlement development grant and the title deeds restoration grant. Both are cut. And specifically with the title deeds restoration grant, you're cutting almost everything. It's a 2/3 cut. We got 67 million previously, almost 68, and it's being cut by 44 million. And then the other two cuts provincially is obviously the community library services grant, which is 34 million, and the mass participation and sports development grant, which is also about 23 million. Those are big cuts. And if you take the total grant increases to the province, which is about 577, I think, and you take the grant decreases, which is about 634, then we are getting a huge cut of 57 approximately million rand to the Western Cape. And that's irrespective of the fact that in our own budget, we have to now reprioritize, the very nice English word essentially for cutting our budget. And that's irrespective of whatever money we'll have to, on our own, find from our provincial reserves. There's a long list of local government cuts that I've noted. The only 3 local government increases I've picked up in the whole division of revenue is the Eskom grant to Theewaterskloof, which is about 780,000 rand. Cederburg local municipality for the wastewater treatment works, which is 15 million, and regional bulk infrastructure for Cederburg. And that's about 30 million rand increase in grants to local government. All the other grants that are being cut to local government in the Western Cape municipalities amount to 314.2 million rand. That's a lot. And even with the presentation I saw at the NA and the NCOP, the FFC also indicated that there doesn't seem to be a criteria for how the reprioritization or the cutting of the grants essentially are happening. And then further, in terms of unallocated grants, I just want to understand on pages 62 and 64 of the bill, there are unallocated grant funding in the school infrastructure backlog grant and the national health insurance grant that also makes up 3 components. And the total amount of that amounts to almost more than 1 billion rand. And I just want to understand, what is that for? How does that get allocated? If allocated, why is there an unallocated amount? What is it waiting for? And yeah, then the health, more specifically in health, President Ramaphosa, when he was here at the CT-ICC at the extended cabinet meeting in the Western Cape, he indicated that cost would be no issue. And it is clear that cost is clearly an issue because we are now directly taking cuts from our programs where we expected money to come from national. And then just finally, I wanted to find out whether the money that is being given with the increase in the equitable share and to the other provinces and to national, is any of that in terms of the international loan agreements that South Africa said it was going to approach the IMF and the World Bank and BRICS Bank and so on? And if so, where has that money gone? Thank you. Honorable Kenyon, or did I lose everyone again?
No, we are with you, Chair.
Okay.
Sorry.
We are here.
I'm just fumbling with my button. Thank you very much. And I always appreciate members that read through the detail of the bill. We put a lot of work into it, and it's a pleasure to engage in the details because we, as I say, we put a lot of thought into it. And I realized that I didn't answer earlier some questions from Honorable Zimba as well. Just on, I think we discussed the repurposed funding question there, but he asked a question about the timing of the transfers, and I think that's quite an important one because, of course, what we're tabling here is an adjustments budget. So the changes that are in this adjustments budget can only legally take effect once Parliament has voted on it, both houses, including through this mandating process that we're part of tonight, and then the President signs it into law. Only then do these become real changes to the budget. But there is an existing budget, of course, and because so much of what we're talking to here is reprioritization of funds, it's not that people have to wait, that provinces and municipalities have to wait for this adjustment budget to be passed before they can spend on any of those COVID-related things. So most provinces and municipalities are using their existing allocations to provide these services in anticipation of receiving the changed allocations that are contained in this bill. So it's a bit of a convoluted answer because it's kind of saying that the money isn't technically there yet, but it is possible to spend on it. And I should also point out, as Zetu pointed out in the beginning of the presentation, that those gazetted frameworks with those new rules that allow for the different spending priorities have already been gazetted. So they were gazetted on the 3rd of July. So those rules are already in force, those percentages within the grants that can be repurposed. And then you also asked a question on progress on the formula review. I think that the appropriate time I could give you a lengthy answer on the consultations that we're in, and we have a meeting scheduled with the provincial treasuries next week, for example. But I don't think it would be appropriate for me to kind of delve into the inner workings of the bureaucracy tonight. I think the appropriate place for us to update legislatures on the progress with that review is in the medium-term budget policy statement. So with respect, I would like to reserve it for there. Then Honourable Bartman, on your questions, there is I guess we all listen selectively sometimes. And certainly when the President made his announcement on the 21st of April, he was very clear that there would be this 130 billion in reprioritization, and that would be the foundation for funding the relief package, and especially the fiscal spending part of that relief package. A lot of our stakeholders read the 20 billion addition to local government and didn't read the 130 billion in reprioritizations, and then were surprised when there's a 20 billion package that is made up of some money that is reprioritized within local government conditional grants, and some money that is reprioritized from elsewhere. So I mean, when you look at those additions to local government, I mean, that money comes from somewhere. That comes from reductions in, I mean, look, money is fungible, so it's not clear, you know, we can't say one-to-one which money comes from where, but we made reductions across national programs, across spending in national departments to fund that. We made changes across conditional grants, and all of that money taken together is the money that we used for these increases. In the case of provinces, we had very lengthy discussions with the provinces through the Technical Committee on Finance and the Minister with his counterparts in the Budget Council. One of the options would have been to make an upfront cut to provinces and then give you back 20 billion for the health system, right? And we all said that that would be destabilizing on the system, that it would be much better if provinces just kept the funds that they have. So rather than making a cut and then an addition somewhere else, rather let's reprioritize within the sphere. So that 20 billion reprioritization is something that the provinces asked for, and that's something that we agreed with them on. So that's kind of an agreement between national and provincial treasuries about how best to structure that. I mean, this is a very difficult time. We've got, as to highlighted in the presentation, you know, we've got these additional demands for services at the same time that we're facing an economic crisis and a 300 billion rand decline in revenue. And we're not cutting net spending, we're increasing net spending, but we really have to reprioritize as much as possible, and the President's mandate was very clear on that. And in fact, what we're tabling in this adjustment budget is only 101 billion rand of reprioritization towards that target that the President has set of 130 billion. And so just within that context, the reprioritization could be even bigger. I take the point on the drought funding. That again, those allocations and the amounts per province have been decided through the sector, through a process managed within the agriculture sector. So the National Department of, I must be careful now to get the name correct, Agriculture, Rural Development and Land Reform, I think is the new name. They've met with their provincial counterparts and kind of agreed on how much each province should get from the 138 million that was available in the Provincial Disaster Relief Grant. The National Disaster Management Centre recommended releasing the full amount available in that grant. So the 25 million to the Western Cape was determined through that process. It's not a decision by the Treasury. It was recommended to us from the sector. I'm very keen to correct one thing, Honourable Barkman, from my statement earlier that I think might have been misinterpreted. The 283 million for the salaries for Cuban medical professionals, that is a national total. That's not only in the Western Cape. If that was in the Western Cape only, Lord knows you would have a hospital full of Cuban medical personnel, I'm guessing. The total in the Western Cape is 45 million. So there was a small amount within the HIV grant that was repurposed into the Western Cape baseline for the COVID-19 component, and then an addition of 552 million. And of that revised total of 588 million, only 45 million is for the Cuban medical personnel. In terms of whether National is paying for them, I mean, National is paying for them through the grant. The grant is transferred from the National Department of Health to the provinces. We could have structured it differently, so we could have held the money back at National, appointed them at National, and then kind of deployed them to provinces. But in our general experience, and this is why it was done this way, it is better for management of them if they are paid by the people that they're working for, so that they're working in the Western Cape. They should be employed by the Western Cape and paid and managed here. and it ensures that that they are deployed and that they're not kind of stuck in head office. There are a few experts, sort of epidemiologists and such, that are also assisting the national department, but we were keen to make sure that they were deployed to the provinces where they can make the most difference. I'm not going to comment on all of the reductions that you comment on. I mean, those are just as I said, that is part of that 130 billion rand total that we were going for. You asked about the unallocated grant funds in the two indirect grants, the school infrastructure backlogs grant and the what's it called, NHI grant, the National Health Insurance grant. The unallocated money in the school infrastructure backlogs grant has been reduced in this adjustments budget, and most of that is of what remains is still going to be used on water and sanitation projects. So that's just by keeping the money not allocated per province at this stage, it allows for greater flexibility for the department to allocate the money as kind of costs change and needs emerge during the financial year. Because that is an indirect grant, it doesn't have to be incorporated into provincial budgets, so it's possible to have that flexibility. On the NHI grant, there's a much larger amount that remains unallocated, and that's on both the personal services component. You'll see, first let me say, on the infrastructure component, you'll see that we've taken away almost the entire unallocated amount there. So the planned infrastructure projects that were kind of a little bit vague, the health department just cut those. We've reprioritized that money to kind of frontline services. You'll see there are also reductions in the unallocated amounts in the other components, but those other components remain largely unallocated because those NHI reforms are kind of much more managed nationally, and the spending is much more at national level with a lot of these kind of testing of new systems. Some of it is paying for, particularly on the non-personal services component, it's paying for things like new systems. And in the development of a new system, it's not always easy to kind of apportion how much of a new computer network is for the benefit of each province, etc. So that's why money is reflected as unallocated there, just because it can in that situation. And then lastly, your question on the IMF, World Bank, BRICS Bank, the various multilateral finance institutions that we've applied for loan funding from. So the answer there is a little bit complex. Those loans are all at different stages at the moment, so I'm not sure, I'm not up to the minute on which ones have been, which tranches we've received, etc. But all of those loans are supporting the general budget spending. So what South Africa is lucky to be in a position where we're not having to say to the World Bank, please give us, 50 million rands to spend on so many boxes of gloves, or item by item. We are they just don't have that kind of strict conditionality. We're still able to negotiate a package. We're negotiating with them because we can get a better interest rate than we could get on the bond market, basically. And so those loans are being used to finance the broader budget deficit, which assists in all of the government spending. So it's not a kind of a one-to-one relationship as such. I hope I've covered everything there. Thanks, Chair.
Okay, thank you. I just want clarity. I just want to find out the Cuban doctors. You say we're going to be paying them from the Western Cape, that they're going to be employed by us, that you guys are sending them. Are they going to be paid directly, like per person, or is the money being paid to the Cuban government? I just want clarity regarding where the money is going to go.
As far as I understand, they're paid as individuals, and they're paid on South African medical grades, just they're based on their qualifications and expertise, etc.
Okay, thank you. Members, any follow-ups before I open up to the public? Okay. Is there anyone from the public that is in the meeting at the moment who would like to ask a question? Okay. Wasima, did we receive any public comments?
Chairperson, no,
Wasima?
nothing on our side, Chairperson, in writing.
Okay, no problem. Okay, I would like to give, it's already 7:30. I would like to give members, is it okay if I give members 10 minutes, just that we suspend the meeting until 7:42, just so that members can get their thoughts together before we come back and put together our report on the negotiating mandate. Members?
Thank you. Thank you.
Okay, so it's 7:42, so I'm just going to suspend the meeting for 10 minutes. To National Treasury and Provincial Treasury, thank you for joining us today. You're welcome to leave on this note, as members will be continuing with the committee business after this. Thanks. And with that, the meeting is suspended for 10 minutes.
Thanks, Chairperson. Thank you.
Thanks, Chairperson.
I hope everyone has run to the bathroom and had a cup of tea and the briefing and put forward our resolutions as well as put forward our position. But what I'll do is I'll start with input and our position so that we can get that done, and then we can do resolutions. Remember, Dagmar, is that your hand or is it still from earlier? Member Mimbi, I heard you, yes.
Yes, thank you very much, Chairperson. I think the presentation from the National Treasury was actually very helpful, and it cleared quite a number of issues, and especially the question that were raised by members. And what was also encouraging was that there is also ongoing discussions that is taking place with National Treasury and Provincial Treasury around the expenditures that are taking place, and also around the national allocation that was done, although it was done nationally, but Provincial Treasury was also engaged, as well as the relevant departments, corresponding departments. So to me, I think that was actually very, very helpful. But also what I also picked up because I was quite interested to find out, because there's sometimes always an impression that other provinces are more favored than the Western Cape, and the Western Cape is always least favored. But what came out from some of the answers is that it's actually everything is left at the discretion of the province to make expenditures while they are actually waiting for the national allocation. So provinces are at liberty to employ their own creativity on how they can actually juggle the money around. So, and of course, one of the issues I know, especially when we are discussing this division of revenue, and when it comes to equitable shares, is the issue of the formula. And the formula is coming a long way. I know that actually what I've picked up when I even attended the NCOPs on the Mondays, most provinces are actually not happy with the formula. But in spite of them not happy, but they are engaging the National Treasury and various treasury around improvements that must take place on the formula that is used. So I think in view of that, then, Chairperson, I will really maybe propose that we should actually give a mandate in support of the bill, the negotiating mandate in support of the bill.
Okay, so Honorable Mvimbi has put his views forward and he has proposed to give a mandate in support. Is there a seconder, or should I take some more inputs before I ask for that proposal then? Honorable Mackenzie, I see your hand.
Thank you, Chairperson. Chairperson, I want to make sure that I get my notes that I've made here. I've written down some here. Chairperson, earlier on, Mr. Kenyan said, and I don't want to misquote him, and he used the word, I think, selective hearing when the president announced, and I've got the president's speech in front of me. The president was very clear. He says additional funding, and I quote from the president's speech on the 21st of April, additional funding of 20 billion will therefore be made available to municipalities for the provisioning of emergency water supply, increased sanitation of public transport and facilities, and providing food and shelter for the homeless. Close quote. So there was no selective hearing, I think he was referring to you, and I didn't want to call a point of order at that point because it comes straight from the president's speech. Now, when you give 20 billion, when you now promise 20 billion to local government, and the adjustment budget only provides for 11 billion, and the remaining comes for repurposing or reprioritization, it's not new money, it's reprioritization of funds that's already in the provinces, and it is cuts from local government budgets. So there is nothing positive about it. If you give me 100 rand that you owe me and just say now suddenly 80 rand is going to come from my back pocket and 10 rand from my front pocket, but you're giving me 90, it's a cut. I shouldn't feel good about it. The similar to the HIV, TB, and malaria outreach program, which is again funding from infrastructure, of the appointment of staff, and in the president's own words, and I mean it's widely available. It's not where he clearly said that that money is not an issue. Where now 2 billion have to be found. Based on the letter that was distributed to members of this parliament by the Provincial Minister of Finance, funding will now need to be used, and that money comes from frontline services. There was no 2 billion rand that sat in a bank account somewhere waiting to be spent. That is money that's going to come from other areas in the Western Cape. There was not in a savings account. This money didn't sit somewhere doing nothing. And I think us as members need to really understand, and I know members understand that. So when there's a net decrease of this, a net decrease of allocation to the Western Cape, and very telling, you highlighted 7 or 8 points that Mr. Kenyon just, because it's factual points that he can't dispute, and he said that he notes what you said, etc. Because these are in the budget. I mean, it's net decrease funding. So there's several of these points that was highlighted. Now I understand that it doesn't want to get involved in the discussion about the allocation to the defense force, like you said, from 400 million or 300 million rand, which could have gone to hospital beds, for example. We don't know. No one's talked. Like, I was making a joke about the plane, which I doubt it is. But these are money that should be spent on COVID-19 issues. Hospital beds. Hey, my battery's going dead, sorry. So when there's several net decreases of these items, I mean, you can't sit with, at least I can speak for myself, I can't sit here and give a mandate to someone to support a budget which result in total net decreases just because it's been reprioritized. And in the words of Mr. Kenyon, when he said in April or some construction couldn't take place because the country was shut down. Yes, we know the country was shut down, but that doesn't make it right because infrastructure funding is still not going to be spent. Next year, we still need to upgrade roads, and where's that money going to come from? So I do think, so having a look at some of these facts, and I've drafted something which I'll send through to you, focusing on all these undisputable facts, which is in the budget book, about net decreases of funding from several issues that you raise and several points that you raise. I mean, I can honestly not give a mandate to anyone to go and support this budget, seeing there are net decreases of these funds. Just because they've reprioritized it, taking the money from my back pocket to my front pocket, doesn't make it right, because it's still a cut at the end of the day. And I will, Chairperson, I did email my more fuller comments through to Wasima, and she's welcome to put it on the screen if you want to. Clear points, including page numbers, as to why I cannot support this budget, particularly on the net decreases on key projects. So it can be there for all members to see. And if Wasima is here, she can put it on the screen. But obviously, you're welcome to take other inputs in the meantime.
I take note. Thank you. We did receive the document that you emailed in, Honourable McKenzie. I'll ask Wasima in the meantime to put it on the screen. Honourable Nkondlo, you had your hand up.
No, Chair. I'm not sure what would be the best way of dealing with this, because clearly, and Member Mackenzie must maybe help us to determine whether this submission he's talking about, is it a submission that he has done now after engaging Treasury, or it's a predetermined presentation or points that he engaged or he made, before he engaged Treasury, and therefore he still stands with whatever comments that he had picked up. Then clearly there was not even a purpose of this engagement. And for me, I think, Chair, it becomes important to decide whether we want to be politicians about this and take, the normal trend that when there's a DORA from national, there's always a political position taken that, in the committee, members of a party will take a particular position. I think we must really get to a point where we mature in our conversation and get to that. And I'm raising this because I think at this particular point, with all the issues that have been answered by Treasury, and again, we are talking about a particular environment, fiscal environment, that even when we're doing our own budget as the province, because I'm going to be very interested when we get to the provincial, adjustment budget, whether we will be talking about the same sentiments that we are raising now, that we're talking about a particular fiscal environment that didn't start with COVID in any way, because even at the time when COVID affected us as a country, we know that we're sitting with a very precarious, economic environment. And therefore, I think my stance, and I'm sure would have been obvious, my stance is that given the submissions and noting, which is something I think we had raised in the previous conversation, that we would like also to make note of some of the issues, especially on conditional grants, which, once again, if you consider the issue of spending, including this province, including municipalities, there is nothing new about the issue of underspending on conditional grants, especially those that had to do, with spending in areas where, poor communities are supposed to be affected. And it is interesting, once again, that in this conversation, Treasury and Provincial Treasury is here, is indicating that, this conversation was taken, with themselves. So I'm just saying, Chair, at this particular point, I am not sure if we were to say we are not supporting this particular budget, what exactly is the alternative or the proposal that we are having, or we take, our normal stance that we would have taken every time we come to these conversations. Thank you very much.
Thank you, Honourable Mkondlo. I'm not going to answer for Honourable Mackenzie where you referred to him. In terms of, let me see, engagement. Just for the record, the Western Cape hasn't always not support or have supported the Division of Revenue. In the years of the Western Cape Provincial Parliament, before us even, there's been various different indications on the vote, and one can see that in the records of the Budget Committee in terms of the respective minutes. Let me see. Conditional grants. If there's a specific issue on conditional grants or spending or underspending in a particular grant that members would like to include in the report, there's nothing that prevents us from putting it in. This is the whole point of the conversation is, for example, Honourable Mvimbi indicated engagement between treasuries and how provinces can still use the money before the adjustment comes, for example. It's also indicated, for example, how all provinces seem not to be happy with the formula. And similar to the submissions that, the input that Honourable Mvimbi gave, if there's anything specific, the members are more than welcome to do so. And just because Honourable Mvimbi and Honourable Mackenzie are choosing to make two different types or different ways of submission doesn't make either one invalid. But I do think that we have to move quick because a lot of members are going to have load shedding in about a few minutes. Wasima, do you have the document to put up for members? Honourable Mackenzie is?
Chairperson, there are certain things that you can't change whether Treasury was present or not. 2 billion was cut. The president said he's going to give 20 billion. He only give 11 additional and 9 REP. So these are factual matters that can't be changed, whether Treasury is here or not. So these are not in things that Treasury can change tonight. So this document, yes, I did start years because I prepared this document, because these are factual documents that you cannot change. You can't change the fact that billions has been reprioritized, whether it was taken from Peter to pay Paul, was taken from infrastructure. It's not new money. These are facts you cannot change. And that's already been, well, it must first be voted on. We're discussing it because it's got an impact on this province. And the members, right, in 2 weeks' time, when the departments come before the committees in the Western Cape, it's going to be worse, actually. Well, I'm scared to think what it's going to be, because money has been taken from them. So these are the realities that we face. And I agree with her, we're operating in a difficult environment. But when you say you're going to give people money, give them new money. Don't take from Beaufort West and give to Nyasa and then call it new money. It's not additional funding. So these are things we can't change. These are facts. So whether Treasury was here or not, I was not going to change these facts. It's in the budget book. It was ATC. It was tabled to all of us.
Chairperson?
Okay. Let's put up the documents so that we can see. Honorable
Chairperson?
Mvimbi, yes?
Yes, yeah.
Honorable Mvimbi?
Yes.
Yes.
Okay. Now, you see, Chairperson, because also the document is here in front of us, there are some few issues I would like to actually raise on the document. And I don't know whether if this document of Honorable Mackenzie is cast in stone or is it open for discussion. Because
members, these are my thoughts, sorry.
So are they cast in stone? Or you are open
let's
to
not have a debate, but I will allow Honorable Mackenzie to indicate whether the document is up for discussion. I can't see the document though. Wasima, have you been able to put it up?
I can see. Yes, it's up. It's on the screen. I can see.
Okay, so what I'll just then look at the document then from my email from that I got it. And then Masima, you can just tell me where you're at, because I think with my connectivity I'm unable to see the screen. Yeah.
You see, Chairperson,
do you want to take us through the document, and you can always just
No. Chairperson, it doesn't necessarily have to take us through, because I want to talk through it. Because I want to comment on it.
Okay.
Yes, because when I come to
so
committees,
do you want to just
Chairperson,
indicate where you have a problem?
Yes, I will. Now, when I come to the committee, Chairperson, I'm coming with an open mind, coming ready to influence other members and also to be influenced by other members as well. I'm not coming here with a preconceived idea that this is what I want. Based on the facts that are in front of me, I'm willing to consider and say that, look, I think we are right there, we are wrong there. But the tone of Honorable Mackenzie, I doubt whether if he's open to those things. But anyway, let me not prejudge him. For example, on item 6, it says the 2 billion will need to be cut from. Yes. Item 6, number 6. Number 6 of the document. Yes. It says.
Yes. 2
billion will need to be cut from within the Western Cape provincial budget, of which one point then he went down, he says that ANC spin to say that funds will be reprioritized. You see, that's why even Honorable Nkondo was talking about politics. There is at no stage the ANC, I don't know where did the ANC said what Honorable Mackenzie is actually implying.
Last week in Parliament.
No, but that was in Parliament.
Okay.
That was the Committee of Parliament. We had an opportunity to raise it there. but it was not an ANC. That was a joint committee. Of, yes. Okay, yeah, because he's interjecting while I'm trying to put my point on. He'll have an opportunity to respond. I remember the meeting we're in, Honorable Chairperson. It was a joint meeting of the National Assembly and NCOP, and we were invited there, and we were given an opportunity to engage there. But of course, then, and I did not actually see that meeting as an ANC meeting. I just see it as a parliamentary meeting of government. But then he went on number 7, Western Cape Province fundamental disagree with the current equitable share formula. Like I said, that when I attended the first NCOP meeting, most provinces, they were questioning the formula. But now what I'm seeing here in Honorable Mackenzie is not saying what needs to be done, what is the alternative. Just like exactly Honorable Nkondle said that maybe members come to the committee just for the sake of objecting for political expediency. But then because they on point number 7, quite rightly so, he's arguing, I also personally got problem with the formula. But then Honorable Mackenzie is not saying what needs to be done about it. He just continue castigating the formula, which most provinces are also having a problem with. So I would maybe like Honorable Mackenzie, if you can just clarify me on those two issues, point 6 and 7.
Okay. On point 6, Honorable Mackenzie, is it then possible for us to amend the second sentence to take that out? It can always say that reprioritization is essentially the same as cutting, so that the document can speak to the word cut and the word reprioritize as previously mentioned, but that is just then neutralized in terms of that sentence. Point 7, I note Honorable Vimbi's points, but Honorable Mackenzie can speak to that, as in point C, I do see under 7 that he speaks to the factors that needs to be taken into consideration in the review, but I'll allow Honorable Mackenzie to speak to 6 and 7 then. Honorable Mackenzie?
Sorry, Chairperson, before Honorable Mackenzie responds.
Okay.
Yes,
okay.
Chairperson.
Sorry.
Yes. Can you clarify, because I hear you saying we can change the 6 and 7. Can you clarify the standing of the submission of Honorable Mackenzie in the committee? Because I would think, like, as we are making the inputs, that this is his input. It is not a committee document, because if it was, we would all have been given this document so that we can be able to engage it. Now, at a time of resolutions, with the pressure of time because of the other members, we are not going to have the time to engage this document so that it becomes a reference for the committee. So I'm worried about how we are managing it. So if you can clarify for me, what is the standing of this particular document in this meeting?
This is my can I? Okay.
No problem. I know you weren't necessarily in the beginning of the meeting immediately, but in the beginning I was explaining the process of the Division of Revenue amendment, how it got to us, and the time frame we've received in order to get things done. For example, by tomorrow we need to submit to the negotiating mandate. Members, for example, Honourable Vimbi has made input earlier, and Honourable Mackenzie decided to put his input in writing. And despite the fact that there's such a short input, members are happy to put their input into writing, the same way if someone had to come to the committee and say they want this particular sentence in the report. Now we're discussing what is going into the report, and Honourable Mackenzie is saying this is his input, he would like this to be in the report, and that is why we're discussing it before we decide essentially what the mandate is. Before this I indicated that we're going to take input and so on, and then we'll then discuss the mandate. Honourable Mackenzie, you wanted to say something?
That's exactly what I want to say. It's my input into the committee is the reasons why I cannot support this bill.
That's fine. Okay. Would you like to speak to the questions from Honourable Vimbi?
Well, I also go into meetings with an open mind. If new information comes to light, I'm willing to change my position. But like I said earlier on, when Mkondo raises the matter of Treasury, the majority of these things you can't change. Not the majority, 95, 99%. That is the budget that was tabled. And these are currently in the blue, well, I call it the blue book, not still the blue book, but it's online. These are the facts that are in the blue, so you can't change them. You can have different perspective, call it reprioritization, call it a cut. These are the things one can use. And I think, but the reality is, in my humble opinion, that these are cuts, and these cuts are going to affect us in this province. We are in difficult times, and I know full well, Member Nkondlo. And it, but it doesn't make it right that the provinces consistently get the brunt of what should not be happening. Not only our province, and Member Vimbi is right, Gauteng, the KZN, they raised that matter, as you say, equitable share. They're not happy with it, but it doesn't mean we have to accept it. Gauteng or the KZN, that the provinces must get a brunt, including municipalities, the brunt that should be cut. And I make a joke about that funding earlier, about the defense vote, but I can tell you that not the purpose of this meeting, where that money is going to, is not the purpose of this meeting, so I'm not going to go into detail of that, but it should be going to provinces.
Okay, so let me go through the inputs I've received so far from Honourable Mvimbi and Mackenzie, and then if I can just get indication of whether members support or oppose this going into the report. Member Mvimbi spoke about the ongoing discussions between National Treasury and Provincial Treasury regarding funding. I don't know if there's anything specific you wanted to say about that. And then, so let me first deal with that part in terms of the report. Member Mvimbi, do you want to give clarity to that?
On what, Chairperson?
Because you spoke about, with your input, you spoke about ongoing discussions with the National Treasury and Provincial Treasury regarding funding, and you went, yeah? So you want to give clarity
yes,
for that?
We can support the bill. We can support the bill and have an ongoing lobbying and engagement, because it's all about lobbying. Other provinces lobby the national government. I think as the province, we can also do the same as well. For example, I'll give you one example. The response from the National Treasury, they were saying that some of the expenditures we are seeing in other provinces, that is being blamed, that is the national government that is pumping money. The National Treasury said that no, it's those provinces, they get creative about their funding. If Honorable Mackenzie is worried about not getting the money, for example, he says there is no money that is being cut, but if you spend money, for example, on food relief, you spend money on public health issues and challenges, COVID-19, you spend the money in the province, and then you convince national government that, look, I've spent money on this. Surely the national government is not going to look at that negatively. But also, Chairperson, on the issue that the Honorable Mackenzie has raised, so does he still maintain that it's an ANC spin about this reprioritization thing? And then also, as I said, on point number 7, on the equitable shares, he's just criticizing the equitable shares. He's not proposing an alternative and say that, look, while I have a problem, this is what I'm proposing. Or is he falling into this thing of saying that I'm just criticizing for the sake of criticizing?
Okay, Honorable Mackenzie, in terms of point 6, are we able to change the second sentence?
I'm happy, Chairperson.
Okay, change the second sentence then. Let's see here quickly, because I can't see the document online, so I'm just going to see it on my email then. Point 6. Perhaps the sentence could be that reprioritization is essentially the same as a cut. That could perhaps be the sentence. Point 7, Honourable Mackenzie will have to speak to that, but honestly, I support Honourable Mackenzie's points that he has made for the specific reason also with the provincial equitable share under point 7. It's okay to say what you disagree with. And previously, it was said, for example, okay, you say you disagree with the provincial equitable share. Why does one disagree? And I see that the document clearly shows that what specifically is disagreed with in terms of the equitable share. I mean, at the education part, for example, it says that the provincial equitable share formula does not adequately provide for learners who require special education. And I remember in the last division of revenue meeting, the one before that, that they actually said that learners with special needs aren't taken into account in the education component in the provincial equitable share. So even though they require more money, for example, for their teaching and their learning, they get the same amount as someone who does not have special needs, for example. So the A is quite clear. B seems to relate to the FFC and quality and reliability of data with regards to human settlements and transport. So I don't see what's difficult about that part. And then C says in the review of the formula that the above factors should be taken into consideration. So that's actually, I think, a clear resolution as part of number 7. And Honourable Mackenzie has already indicated with number 6 that we can change that. But the rest of the information, given that what Honourable Mackenzie, what is before us, is all factual. It's all references as to this amount on this page, this reference under this grant is being cut, for example. I don't see anything wrong with that. But members, it's getting quite late, it's 8:15, and I do know that many members have fallen off our call because of load shedding. So I would like us to move forward. I know Honourable Mvimbi has put forward a recommendation to support the bill.
Chairperson.
Who's speaking?
It's Member Doug.
Honourable Dugmore, yes?
Yeah, no, Chair, I just noted that you referred to load shedding. I'm not sure whether you're aware that at this point in time, Eskom has 34,000 megawatts of power, which is the highest it's ever been this year. And therefore, from 10 o'clock this evening, there's not expected to be any further load shedding for the rest of the week. I think we should actually commend Eskom for having achieved, despite difficulties, the highest amount of energy available for 2020, which is 34,000 megawatts.
Excellent.
Yes, I do know about that. The Eskom people did message me earlier today with regards to the load shedding, but I'm not sure if we should be commending people for keeping the lights on, which is essentially their job.
Chairperson.
Chairperson, sorry, I wasn't being totally serious about moving that as a resolution. I just was responding to your question. I will withdraw my resolution if Member Mackenzie withdraws his document.
No, thank you. No, thank you.
Chairperson.
Okay, Honourable Nkondlo.
Chair, I still maintain my position. I would have loved, you know, to have engaged this document as I'm seeing it here now, and it's very much in fine print. And I'm actually being guided by the comments that you are making, agreeing here and there. From where I'm sitting, I would rather not go to that particular approach where I do not have the ample time to go through a document, so that, as you are saying, Honourable Mackenzie's claim that this is, you know, his facts as he has put together. I mean, we must also be allowed, you know, to confirm such facts, and it's good that I think he made the submission. The point that I'm raising, Chair, I think we have to get to some kind of a conclusion, and that conclusion is that there is a proposal here which I supported from Member Mvimbi. There's a proposal of Member Mackenzie which you are supporting, and therefore we just need to get clarity, because the issue here now is about what are our individual submissions, as Honourable Mackenzie has made, you know, to detail, you know, we can also be given perhaps that particular opportunity, so that, you know, given the issue of time that you raised earlier in the meeting, we can also, because I would also love to read his document, so that where I agree with him, unfortunately I didn't have the time, where I agree with him in the, I don't know how many numbers of the points that he has raised, you know, if I agree with all his points, I'm more than willing to say so. But I'm not just going to be coerced now and say, because there is a presentation in front of me which I didn't have the time, to be able to engage. So I want you to really help us to conclude on the matter on how, we get to a decision, because I think there are views like the document of Member Mackenzie, and he said it is not a standing committee document, it is his views. There are views. So how do you integrate the views into a view of the committee?
Okay. Members, regarding not being able to engage the document, it is not any member's fault that there is not time to engage any document or any extra input, because the bill was only completed in the NA yesterday. Because the bill was only referred to us recently, and we need to give a negotiating mandate tomorrow. Tomorrow is the 17th of July. That is the date we got from the NCOP. So between the 15th of July and the 17th of July, we have one day where we also had a sitting, and we also have 2 meetings already on the 17th. So in between all of that, the NCOP gave us this deadline to submit a negotiating mandate. And previously, members specifically asked that we make sure that we put our comments and our reasoning in the negotiating mandate and not in the final mandate, which is what we are doing now. The NCOP wants the final mandate on Tuesday. They have not even given a time yet by when they want the final mandate answers from us, which is why our final mandate meeting is on Monday. So that is the first point. The second point regarding Honorable Nkondlo supporting Honorable Mvimbi, and while I appreciate Honorable Nkondlo's support in terms of moral support, unfortunately, Honorable Nkondlo is unable to second the proposal of Honorable Mvimbi. Let me speak finish. Let me speak finish. I'm speaking in terms of process at the moment in terms of votes.
But you are out of order, Chair. You
can't
say you can't make your own judgment call, because I can do the same. You can't say my support is a moral support. No, I'm not going to accept that.
The reason I say that, and I'll take it back because it's more in jest than anything else. Honorable Mvimbi is a permanent member of this committee. Honorable Mackenzie is a permanent member of this committee. Honorable Brunkhuis is a permanent member of this committee, although I have not seen him on the meeting. And Honorable Philander is a permanent member of this meeting. Honorable Mvimbi put forward a proposal to support the bill, that the committee supports the bill. I need a seconder for Honorable Mvimbi's proposal, and unfortunately, in terms of the process of the committee, I need someone who has voting rights tonight. That is why I made that comment. So I'm waiting for someone with voting rights to second Honorable Mvimbi.
I truly accept if that is not in relation to my content. If that is about me not being a permanent member, that I accept properly.
So my comment in terms of voting at the moment, it's not in terms of you making comments. I allow every member who has put up their hand in this committee to make comments, and you know that. And the other members who may not be here today, who are also alternates, who also make comments regularly in this committee. Honorable Mackenzie, do you still have your hand up from previously, or is it a new hand? No? Yes?
That was from earlier on, the comment, Chairperson, so there's 2 proposals on the table now.
Okay. So is there a second for Honorable Mvimbi's proposal?
Chairperson, can I just ask something?
Honorable.
Yeah.
Yes?
Could I just ask something? I'm obviously just an observer in this meeting, but you mentioned a deadline. I mean, I'm very interested. I had to leave the meeting for a while, but I also am battling to read the content of Member Mackenzie's document. Can we not have an opportunity and maybe reconvene for an hour tomorrow? Is that something that's difficult or not?
Members, if we reconvene tomorrow, I myself already sit in 2 committee meetings tomorrow, so I have no idea when we would reconvene. Wasima, what time is the budget committee, the appropriations? I don't know which committee of the NCOP sitting tomorrow.
Chairperson, they didn't give us a time yet, but they did say that they're sitting on the negotiating mandate, and we will have to provide that negotiating mandate as soon as possible. So we're still trying to get hold of National to find out what is the time of the meeting.
Okay. So now we know also now that there will be a negotiating mandate meeting, which we need to provide a negotiating mandate for the NCOP, but they themselves do not know yet what time they are sitting. Hence also why it is quite important for us to put forward our reasons. Okay, because for example, myself, I'm already in 2 meetings tomorrow. If there's no second for Honourable Mvimbi's moving to support the bill, then unfortunately the proposal falls. Is there any other proposal then?
Chairperson, I've made a proposal that we don't support the bill, and I've given my reasons in my written submission why. And I've spoken to it earlier on as well.
Okay, thank you, Honourable Mackenzie. Is there anyone to second Honourable Mackenzie's proposal?
So we agree to disagree.
Just hang on quickly, Honourable Mvimbi. Honourable Philandra, I see your hand.
Yes, thank you, Chairperson. Chairperson, I think it's not a matter of imposing anyone's position upon anyone. We've had the opportunity to interrogate the documents and apply our minds accordingly as to the questions that was raised. Chairperson, I therefore wish to support the proposal put forward by Honourable Mackenzie.
Chair.
Okay. Honourable Wasima, sorry.
No, Chair, I just checked my
yes,
email.
Wasima?
They're meeting at 3 tomorrow morning. I mean, tomorrow afternoon. At 3 o'clock.
At 3 o'clock.
Yeah, so we'll
okay.
have to have
I have
a meeting. Yeah. The mandate must reach the inner.
I have meeting in the morning. I have a meeting in ad hoc, I think. Or yeah. Okay. Okay. Honourable Mvimbi, are you still speaking or?
No, I'm saying, Chair, we agree to disagree. So
okay.
The majority rules.
That's also okay, Honourable Mvimbi. Sometimes we debate and sometimes we disagree. That's also okay in life.
Yes.
Okay. So then, if that has been passed, let me just quickly then go to the negotiating mandate. Will then read. With the reasons included, with the amendment of point 6, which was made from Honourable Mackenzie's input then, that negotiating mandate stage draft report of the Budget Committee on the Division of Revenue Amendment Bill B9 2020 dated 16 July 2020 dated 16 July 2020 as follows. The Budget Committee, having considered the subject of the Division of Revenue Amendment Bill B9 2020 NCOP, referred to it in accordance with Standing Rule 217, confers on the Western Cape delegation in the NCOP the authority to not support the bill. Okay. Okay, Wasima,
also just like to record in our
that document. Hi, Honourable Mvimbi, yes?
I was just going to record my minority vote to support.
Okay, yes, you may.
Yes.
You may. Wasima, can you just send me the rules so that I can read the minority into it? Or Wasima, you can read it for me so that, because I know there's a specific sentence.
Yes. No, that's fine, Chairperson. No problem.
Okay. Is it okay? Okay, I'm not sure now if Wasima fell off on the internet or something, but is it okay if I ask Wasima just to then record the sentence of minority view that you want to support the bill?
Perfect,
and then she can use English. Okay.
Yes, yeah, I'll add it.
Members, is there anything else? If nothing, then thank you so much for this very, very long meeting. Thank you for staying with us the whole time, despite connectivity problems. Wasima, you had something?
No, Chair, I just wanted to ask, are we going to complete the rest of the minutes and the...
In the next meeting.
Oh, you want to just let it stand over?
Okay, members, is it okay if we leave that over for the next meeting? I think members also need to go time to show the partners.
Yes,
Okay,
yes, Chairman.
perfect.
Otherwise, Honorable Mackenzie
members will then leave the rest of the business over to the next meeting.
Thank you, Chair.
Excuse me?
Otherwise, Honorable
Yeah.
Mackenzie will have load shedding. So let's refer the minutes to the next meeting.
Okay, members, thank you so much. We'll leave the rest for the next meeting then. Thank you for staying. Goodbye.
Thank you, Chair. Bye.